Hey, good morning, everybody. I'm Congressman Jimmy Panetta, and I'm doing these webinars to highlight a couple of issues, obviously, as we go forward during this pandemic. May is Mental Health Month, and I believe that there's no better time, not just this month, but in this pandemic, upon which we can actually have a serious discussion, or at least have a discussion about the resources that are out there to have a discussion when it comes to everybody's mental health. A few of these webinars that I've done, as any of you know who has followed, has basically seen that we've talked about services in Santa Cruz County and Monterey County. And now today we're fortunate to talk to Maria Sanchez and Juan Gutierrez in regards to mental health services in San Benito County. This week, we unfortunately hit the 100,000 mark when it came to deaths from the COVID-19 disease. And so we don't really know how much more that number is going to grow. We do know that when it comes to our mental health, though, it's going to affect all of us. And I think that's why it's so important to understand and to know that we have services right here in our backyard, in our front yard, there in San Benito County, that can help people deal with these difficult times, from abiding by the shelter-in-place orders, the loneliness that can come from that, the unemployment that can come from this pandemic, and so many other issues that are going to affect us, not just during this time, but as we go forward, as we continue to fight this disease. In dealing with this pandemic. So I wanted to highlight, obviously, Maria and Juan with the San Benito County Office of Behavioral Health, and talk about how the virus impacts our mental health, and obviously the resources that they have to help us cope. So there's two of you. I haven't done this with two people, so I'll let you guys decide who answers what questions. So why don't you, if you could, tell us about your work with the Office of Behavioral Health and how you help community members in San Benito County, and how can people safely access your services during not just this time of social distancing, but going forward as well, when we kind of shape social distancing per the regions that these orders are going to be in place.
Yes, thank you, Congressman, for the opportunity to teach the public about the services that we have offered. So when this pandemic became a real big crisis in the county, our department was deemed a essential service. So everybody who is employed by the behavioral health department was maintained active. We did have to improvise and make sure that we were able to provide the services in a safe manner. We didn't want interruption. We wanted to make sure that the continuity of services stayed as best as we could. In order to ensure the safety of the public as well as of our staff, we were able to rotate shifts of the employees, so there was less employee presence in the building during business hours. So that meant that we had to shift a lot of services on a virtual platform, much like many other agencies and companies have been forced to do during this time. So we were able to provide telephone conference meetings with our clients. We had video meetings as well with our clients, make sure that they had that face-to-face connection if they were able to obtain the platforms necessary to engage. We also managed to do group therapy services through virtual platforms. So our platform has been through Zoom, which, as for many other people, going virtual was a challenge in itself when you weren't used to it before. So luckily it's gone on without many issues, and the clients have continued to be engaged, which is ultimately what we wanted. We wanted to make sure that they continued getting the services that they needed. We understand that not everybody has access or ability to have treatment through these platforms. So we were able to maintain the option to see clients in the building with a live person. In order to accommodate that, we have been able to provide masks and hand sanitizer for those who do come in on a more intimate level. We've managed to allow distancing within the therapist or the case manager and the client, and ensure that the face masks were on at all times so that they can still maintain that.
So you're actually allowing people to come into the office during this time?
On a limited basis, yes. There's some exceptions that our psychiatrists have made. Some clients just need that more intense personal level of attention, and a lot of them are doing well with teleservices.
Good. On the teleservices, so it's telephone, it's internet on both of those, correct?
Correct.
Yes.
Okay. And on the teleservices, that you're finding that's something you've done before this pandemic, is that correct?
We've always had telepsychiatry for a specific population that can adapt to those types of services. So we've been doing that for several years. We're kind of a little experienced in doing this. It's just more facilitating this for our clients that may not be so adept at using the electronic equipment.
The virtual rather than the phone. That's what I was going to get to in regards to the internet, like we're doing right now.
Yes.
I think, I think based on the number of calls, the number of Zoom calls, the number of virtual meetings that I've had, I do believe that the word of this pandemic is going to be, or the phrase is going to be, can you please unmute yourself?
Right.
Because there's a lot of people, even on simple issues like the mute on and off button,
Right.
people have difficulties. Not to say, not to disregard the fact that a lot of people just don't have access to the internet. And are you finding that a problem? And if so, do they fall back on the telephones, or do they fall back on coming into the office? How are you dealing with, at times, a lack of internet connectivity?
We have a lot of staff that have been doing phone follow-up, so we've kind of accommodated to the needs of the clients. If we have difficulties getting in touch with them via the Zoom or telepsychiatry, we have case managers that reach out and have made phone contact. The therapists are also reaching out to the individuals, so we've been really tailoring it to the client's needs.
Good, great. And you said you do on the virtual for the people who can get online, who can get to that Zoom room that we see on our screens. Are you finding how do you reassure them in regards to confidentiality and security? We've all heard these issues about Zoom and people Zoom bombing and things like that. How can you reassure them that discussing something as sensitive and as personal as mental health, how can you reassure them that it is confidential?
Well, our staff are well trained on confidentiality, and I think that's one of the first steps they take in assuring clients that the conversation is going to be confidential. As Juan mentioned previously, they are doing it out of the office here, and the ones that have done it from home have been trained on adhering to confidentiality. I mean, we feel pretty confident that our staff, that's an ongoing training for our department to ensure the confidentiality of clients. We're held to a high standard when it comes to confidentiality. So we haven't been made aware of any issues with that. I think our staff are trained to provide that comfort level to the clients to open up and get help from us.
Great, and that high standard of confidentiality is through all venues, be it the internet, be it through the phone, be it in person. Is that correct?
That's correct.
Right, and prior to the shelter-in-place order taking effect, we also had an all-staff meeting and gave everybody a heads up saying we most likely will be going to do a virtual platform, whether it be by telephone or by Zoom. And we did request that everybody have that conversation with their clients and say, this is what we have to do in order to meet the needs. And this is how we're going to maintain your privacy, your confidentiality, to make sure that everybody really felt at ease and were as informed as possible given the situation.
Great. Now, if you could, and just to highlight for some people who are watching, Talk to me about some of the issues you and your employees are encountering during this pandemic, be it loneliness, be it other issues when it comes to mental health, so that people can at least have an idea not only of the work that you do, but that the issues that can be out there and that can come up when it comes to being in this and enduring this difficult time.
Yeah, I think that part of the main issue, I think, is exactly what you said, right? Loneliness, shelter in place. Many people who even may not be used to being so isolated, being really forced now to stay at home or limit the contact with people. That's just hard in itself. So we've made sure to try to engage people in any way that we can. So we have the clients that we made sure that they understand kind of what's going on, what the situation is like for everybody, and let them know that they're not alone, even though they feel alone, that they're really sharing this concern with a large population. And we try to give them the tools on how to reach out if you're feeling really down, how to keep yourself entertained to make sure that you're not just sitting at home thinking about being alone. Additionally, behavioral health department has a Esperanza Center where we welcome the older adult population, the adult population. We do have groups for youth that are 14 to 25 years old that we have special. We've had to postpone at this moment because of the shelter in place. So our efforts have been to reach out specifically to those clients who have been coming up. They may not be clients of behavioral health with regular therapy sessions or clinical sessions, but they are visitors to our center. So we understand that may have been part of their routine, their daily routine previously to keep themselves entertained or engaged with other members of the community. So as an effort, we've tried to contact them and let them know, hey, we're thinking about you still, we're working on what we can to make sure that we open the center. And meanwhile, the elderly population who are in a senior community in this area, we've taken an extra step and gone out to see them in person and hand them a little flower pot with little seeds and a little growing kit to let them know that we're still thinking about you, and you could, even though it's a small activity, you can tend to this flower to keep you entertained and just remember that we're here for you.
So some of the is a lot of anxiety, and Juan has been posting on our Facebook page some articles that may be helpful to the community and coping skills. We also have had some webinars that have been targeted directly at coping strategies during this time, and so we have a series of those webinars every Friday. So there's several things we've done to try to address and help people who may not be directly reaching out to us.
Yeah, that's great. That's great that you guys are actually just doing outreach and not just sitting back and waiting. I mean, it's been difficult in the sense of not just getting through this pandemic and the physical and mental health, but also for our spirit. We are a community in San Benito. We are here on the Central Coast and across this country. When we're faced with adverse times, we're used to leaning into it. We've been actually asking people to stand down, to stay at home, that it's okay to watch Netflix all day long. But obviously, depending on what type of population you have, that can be difficult. And it's funny, I was reading, and I have another webinar later on today to focus on youth. But it says, I read an article in Washington Post yesterday, and I'm going to highlight this more in my subsequent webinar today. It says, what might be surprising, however, is that symptoms of psychological distress are directly correlated with age. Among those aged 18 to 29, 42% reported symptoms of anxiety and 36% had symptoms of depression. And you're dealing with an age category that's used to having that interaction, used to having things to do, and then all of a sudden we're just cutting them off. So my question is, are you seeing an uptick in those at a younger age using your services?
We have so we have a school program, and we have a group of staff dedicated to reach out to the youth and children and youth. So we made a contact with the school, the administrators at the school system, and developed a way to have these kids referred to us either by phone or in person, should they notice something during the time that they're being at home, and possibly notice something when they're getting the instruction via via Zoom or another platform. So the case managers have actually been contacting the schools on a regular basis and developed a referral system to reach out to the kids. And we know it's been especially harder for youth and adolescents, again, because of that social aspect of it, that's pretty much their life, being out there and connecting with people. The case management team has also done some home visits with social distancing. They haven't come to the front door and from the front of the yard. Because sometimes the youth, they need to see somebody in person. It's one thing to deliver the service by phone, but I think it's more effective to have that connection and that face-to-face contact too. So we've made a lot of efforts to try to reach out to as many youth as we can through the school system, and also the ones that are not in the school system.
That's great. That's great. And that's really good to hear. Your understanding, your appreciation, I just say, of course you understand it, your appreciation for ensuring that there is that physical, personal interaction, which means so much to people. I mean, nowadays, we rely on these quite a bit, but nothing beats the face-to-face interaction. And I even think, being in person is much better than these Zoom calls. Obviously, we're having to do this type of meeting today based on where we're at in this pandemic. But I think that's absolutely wonderful that you are actually getting out there, out of the office, away from the computer, and having that face-to-face interaction, which can really mean so much, especially to people who are experiencing any sort of mental health issues. So thank you for that. That's great. In another population, how are you? Tell me about your language services and how that works, especially with the Spanish-speaking population that is so prominent, and we're so proud of that here on the Central Coast.
So we're fortunate that we have a large staff that is bilingual in Spanish and English. But we also have a language line service that we contract with for those individuals that may speak a different language. So that's accessible 24/7 to our staff to facilitate the conversation with individuals that may need that. But our teams are large enough and bilingual, bicultural, that we haven't encountered really any issues with that. There's always someone that can tag team with somebody who speaks Spanish. And we've been able to just serve, that population.
Great. What about other languages, just in case? If someone does come in and speaks another language besides English or Spanish, do you have other ways to address that?
Yes, we contract with a language line that's available 24/7, and basically you can access any language interpreter. So, it's a little bit more work because you have to do a three-way call. But it's a way of understanding what the issue is and being able to talk to the client, and then linking them up to some assistance, some help.
Great, good. Now, obviously, you guys are the experts in this area, and I'm sure I missed something. Is there anything else before we wrap up here that you would like to mention in regards to your resources when it comes to the San Benito County Behavioral Health Department?
I think what we'd want the community to know is that we are here to help. We're adjusting to a new way of helping. And I think we're starting to come up with new and better ideas on how to reach people. But I think for now, our doors are actually open. And we'll take every safety measure to make sure that each site is protected. We want the staff protected as well as the community. But we are here. We have after hours. If you call the number, our main number, there's a way to reach a crisis person at all hours. whether it be in the middle of the night, at any time. It's 24/7. That's one way of supporting people. You can walk in here, you can call us and schedule an intake. We're conducting business the same amount of services and the same type of services, with the exception of limiting some to phone that possibly can be done by phone or telepsych.
Great. And so let's provide people, please, with the contact information that they can use in order to get contact the behavioral health department there in San Benito County.
Of course. So the main line is 831-636-4020. For at any time you can call, even if it's after hours, and it'll be transferred over to our crisis line. If you want to call the crisis line directly, that number is 888-636-4020. So luckily it's the same number. It's just 3 digits beforehand that change. But feel free to call at any time, even on weekends, and there will always be someone who is available to guide you on the next steps.
Great. And then online, is there a specific website?
You can go through cosb.us. That's our main county page. And on the toolbar on the top, there's the behavioral health option under departments, or you can just type cosb.us/behavioral health.
Great, great. And once again, in order to get a hold of you, your general number is 831-636-4020.
Yes.
And the 24/7 crisis line is 888-636-4020.
That's right.
And someone will always be there to answer that phone. Is that correct?
Absolutely.
Yes, and they are trained staff to help with every situation.
Outstanding. Great. Well, look, Maria and Juan, I want to thank you very much. And I also want to let people know that we too in my office are continuing to serve as well. And we are answering the phones Monday through Saturday, 9 to 5. And obviously, if there is an issue that we can help out with on the federal level, be it with immigration, be it with healthcare, be it with IRS, Social Security, VA, military, any federal issue, know that you can reach out to our office at 831-424-2229. Once again, in order to reach my office, the office of Congressman Jimmy Panetta, it's 831-424-2229. Maria and Juan, thank you for your time today, but more importantly, thank you for the services that you and all of your employees are providing to the people of San Benito County and to the community here on the Central Coast in dealing with issues that are very sensitive when it comes to our mental health. But knowing what experts you are and how you know how to do it, and not only how you know how to do it, but how you know how to have that outreach to people so that you're there for them, not just during this pandemic, but thereafter. So look forward to continuing to support you in any way that I can, and look forward to continuing to hear about your work when it comes to making sure that all of us are secure physically and mentally going forward. So thank you, and thanks to the San Benito County Behavioral Health Department, and appreciate it. So thank you once again.
Thank you for the opportunity.